Sometimes clients may get the impression that it's taboo to broach the topic of religion or spirituality in the therapy room. It is so important for clinicians to take assessment or just to even ask a client about their beliefs and if they would like to discuss or even integrate certain beliefs into their treatment. A journal by Hathaway entitled Ethical Engagement with Spirituality in Clinical Practice, Managing Bias, reported on being culturally sensitive. It is important to not make any assumptions pertaining to the religion or denomination your client may identify with. Also, especially if you and your client share the same spirituality. For example, Hathaway shared a story in which a Baptist marriage counselor was treating a Baptist client about marital problems and assumed the client did not believe in divorce due to traditional Baptist beliefs. Remain unbiased. Hathaway reported that mental health professionals are less religious than the general population and that sometimes bias can appear as a therapist simply neglecting to discuss a client's religious or spiritual needs. While healing touch was briefly discussed, it is important to reference that clinicians should have in their informed consent that touch will be utilized in therapy. This will help reduce being sued or even having allegations placed on the therapist. Latour mentioned in her article that the no-touch rule with our clients came from Sigmund Freud, as it can confuse boundaries and cause transference and countertransference. However, there have been much research since Freud's time that shows that there is great evidence that touch can actually be quite effective in clients' healing and their treatment. So here I just kind of gave an example of a healing touch consent form that I found online that just shows, the basic functions of what therapy will be doing with the client. And how it will also reduce certain symptoms like pain and anxiety, and really help with emotional and mental spiritual support. But it's also, again, very important as we clinicians know how it is to, not want to touch your clients, that we definitely have that in our informed consent. Also, it is always important in your clinical practice to have a client sign a release of information form so that you can be informed about other treatments with providers. It could greatly benefit the client if there are either treatment team meetings in which all providers are welcome. You can have phone discussions with another provider as well as receive correspondence of their important documents, and or you can simply just invite that provider, if it's a complementary therapist, to your session. As we learned in some of the other research, many other complementary practitioners invited the counselors to the sessions. In the Collins study, the researchers actually had a mutual referral relationship with one another. Funding. If you're going to be working in an agency in which you take insurance, it is important to remember that insurance will only reimburse if there are evidence-based theories. So it will be important for clinicians to think about how to bill and write notes if they want to incorporate complementary methods such as healing touch, acupuncture, or Reiki, or at least try to find a third-party investor that is willing to invest in your complementary methods. Then always, 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 always seek supervision, as supervision is getting an objective opinion and can help check any biases, fears, transference, or just aid in treating a client. It is always important to remain ethical and discuss touch and religion and politics and certain cultural beliefs, as these can be delicate subjects. In closing, I hope that I was able to enlighten everyone's view on how to use alternative methods in psychotherapy, as well as incorporate some psychospiritual interventions. And I want to leave you with a quote I read in an article entitled by Are Religion and Spirituality of Relevance in Psychotherapy by Barnett. It is not consistent with our profession's ethical ideals to only focus on selected aspects of who our clients are. Thank you.